There are now a growing number of therapists you can Skype. Therapists are often turning to online therapy as a way of improving their service. I mean, obviously, it's very convenient if you're moving or traveling abroad or living abroad, then you can continue your therapy sessions in your new location. The other advantage of seeing a therapist via Skype is if you are homebound or find it difficult to leave home. And this, of course, covers people who are suffering from agoraphobia and other anxiety disorders. So being able to see a therapist from home is very convenient and allows you to continue getting the help that you need for effective recovery. We use Skype simply because it allows you to see each other, and if you can see each other in real time, then the quality of communication is just as effective as it would be seeing a therapist in person. This is the case for the vast majority of people. Really, you only need to see a therapist in person if you're seeking some form of medical treatment and you need a prescription medication or whatever. But most people don't really benefit very much from prescription medications. What they really are looking for are more effective ways of managing their emotions. So if you're struggling from anxiety, you want to learn how to manage your anxiety more effectively. If you're struggling with depression, it's the same. You want to be able to learn how to manage your depression yourself. Or if you're struggling with an addiction, you want to learn how to heal the underlying emotions that are fueling that addiction. So that is what I specialize in doing. I teach mindfulness therapy, which is a very practical, very focused method of teaching you how to work with your emotions more effectively. The key component here is learning how to develop a different relationship with your emotions. The real problem that I see over and over again is that people tend to run away from painful emotions. If you're suffering from anxiety, the tendency is to develop a fear and hatred for that anxiety. And that, of course, will simply fuel the underlying anxiety and prevents it from healing. With depression, the tendency is to become completely overwhelmed or consumed by the emotion and the reactive rumination that accompanies depression. So we have to change the relationship that we have to our emotions, and that is the primary teaching in mindfulness therapy. And we do this by actually developing skills in meditating on our emotions. This means simply that we make the emotion the focus of our attention, but to see it clearly as an observer and not become reactive or identified with the emotion, not become overwhelmed or consumed by the emotion and its reactive thinking. We have to learn to see these things clearly. It's the seeing that is the most important component of mindfulness, and it actually helps you liberate yourself from the reactive habits that create anxiety and depression. It's the seeing of those emotions, seeing those thoughts clearly without further reaction. That's the key, that's the way forward. So that's one very important part of mindfulness therapy, is learning to clearly see the thoughts and emotions without becoming identified and lost in those thoughts and emotions. Then we start to explore how those emotions work. We see the patterns of reactive thinking, and we begin to break free from those patterns by seeing them clearly. But the other major factor that causes emotional suffering is imagery, how you see anxiety in the mind, or how you see the emotion of depression or sadness or hurt or grief or whatever it might be. How you see those emotions in the mind is really what causes the emotion to persist. So we have to look at its imagery. We have to look at the imagery of our anxiety or depression and then help that imagery change and heal. So the primary problem is that the emotional imagery becomes stuck in the mind. It stops healing, it stops changing in a direction that leads to healing. So we have to see that imagery and then help it change by developing a conscious and compassionate relationship with the emotional imagery. When you change the imagery of your emotions, the emotions begin to heal. So that's a very big part of mindfulness therapy, as well as developing just the basic conscious relationship with your emotions, where you remain as the observer and don't become caught up in the content. If you would like to learn more about working with a therapist online through Skype, then please go to my website and read more about this online therapy service that I provide. It's available worldwide. All you need is a good internet connection, and then you can conduct Skype therapies at a time that works for you. I see people throughout the USA and Canada, and a few in Mexico, and a great number of people in Western Europe and the UK, but also as far away as Australia. The thing that matters is, do you want to change? Are you motivated to change? If you are, then I will be happy to give you the tools to help you change more effectively. So if you'd like to learn more, then please go to my website and email me with any questions you may have about working with an online therapist, or about the mindfulness therapy approach that I teach. I can give you some information from the clients that I've worked with over the years. Almost all of them have already tried conventional counseling and found that it's not really getting to the root of the problem. Almost all of my clients have already tried medications and also found that it's not really changing anything. Medications have a very limited usefulness for treating anxiety or depression. They simply mask the symptoms, and that's not really sufficient. You have to change the underlying psychological process that creates your anxiety and depression, and that's what I teach during our online Skype therapy sessions. So please contact me if you'd like to learn more. Thank you.